Hello, Laura.
Hello.
Thank you so much for coming. I'm really, really happy to have you here. I'm so happy you agreed to do this. Thank you so much.
Of course.
Would you mind telling the listeners who you are?
Who am I? Well, my name is Laura Becker, but you might know me as Funk God. I'm an artist and a writer, and I'm also a public detransitioner. I transitioned when I was 19 and 20, medically and socially, and then I detransitioned when I was 22. And for the last 4 years, I've been doing public advocacy work, writing, doing activism. And at this point, with everything going on culturally and politically and psychologically, I am just trying to raise as much awareness as I can about medical ethics and mental health care, and offering some sort of insight into the craziness that's going on right now.
Yeah. One question that I wanted to ask. So what time period was this? Like what year was it when
Um,
you
so I started taking testosterone when I was 19, and that was 2016. And then I had a double mastectomy when I was 20, which was 2017. I detransitioned in around 2019. And yeah, since maybe for the last 2 years or so, I've been very active doing interviews and that sort of thing.
so I was thinking about something earlier today about because I'm very curious about what's going on in the schools and like what what all led up to this, because obviously it's not something that happens overnight. And what I'm getting, like, not just in your personal life, but what was happening sort of, yeah, like at your school and stuff at that time with like trans and things like that,
Um,
because what's going on right now is so blatant and out there, and I'm just curious what it was like, several years ago.
Well, it's different in every state and school district, but in mine, which was in Milwaukee, Wisconsin, in the Midwest, it wasn't as severe, especially then. I was kind of maybe an early adopter of the trans and queer illusions. So it was a very accepting school district overall, liberal leaning, but mixed. It had enough moderation in there, and there was very little bullying at the school. It was overall a pretty accepting environment for gay people, and that was more the emphasis back then. It was back when the clubs were still called the Gay Straight Alliance Club versus some of the newer names like the LGBT Club, or they call it the Acceptance Club, or these different euphemisms for more queer theory. But back then it was mostly about gay acceptance, and it was only more so being introduced when I was maybe a senior in high school, the more queer side of things. So for me, I primarily learned about the identities and everything through social media. I learned about it through Tumblr specifically, and that was when I was around 15 and 16. So like 2014, 2015,
Okay.
or 2013 even. And so I was learning about it there, but then the high school district that I was in was accepting and tolerant, and it wasn't very deep, it was just shallow acceptance. And then the college that I went to, the University of Wisconsin Milwaukee, also had a strong reputation for LGBT acceptance, and the queer theory was a lot more prevalent there. So in my freshman year of college, that is when I came out as trans. And although I've been questioning since I was 15,
So
but in
basically,
college it was more prevalent.
15 is when you started seeing it on Tumblr and stuff.
Yeah.
And so how long between first you first ever hearing of it and you thinking like, maybe me?
It's hard to say because I was, when you're on Tumblr, it's percolating. You're kind of marinating in all of this social justice stuff with race and gender and class and everything. But if I was maybe a year or so, a year and a half, there wasn't an exact moment when it kind of, you know, came about. It was more like, we're all questioning our identities. And I had a complicated time because I was diagnosed with autism and depression and anxiety. So I already had like this really crazy, identity issue with the autism, like conceptualizing being like a very like a mild like autistic traits, like a high functioning autism, and then you have depression. And I also had undiagnosed complex PTSD. So I didn't realize I had
Mm,
PTSD at the time, but I also had that variable. So it's like I was already doing some heavy identity exploration and pain and crisis. And so over time, the queer label, just the gender queer, non-binary label started to appeal to me because I was always so much kind of an outcast and different and having issues with, self-acceptance, you know.
yeah, my goodness. I can see how that could be very appealing for anyone who's feeling confused because, and especially when you add queer in there, because that can really encompass anything. So if you're feeling like you don't fit in and there's this umbrella where you're like, oh, maybe these are my people, maybe this is my thing. I can see how that could be very enticing.
Yes,
So how did
especially when you are legitimately androgynous as well. I was always a tomboy. I dressed in mostly boys or men's clothes. I was not feminine whatsoever aesthetically. And so when you dress androgynously and you're kind of weird and depressed, like those three things, basically that's what queer means. It's just an umbrella term for anything,
right.
but we have those three elements. Yeah, you're going to get really into that as your sort of people.
Let me ask you a question. This is getting off your personal story for a second, but this is making me think. I was in a call earlier today, a Twitter space, and Scott Nugent was in there as well. And he was talking to someone that was um, non-binary, and he was saying, like, no with the non-binary. And I'm just very curious, like, what are your thoughts on non-binary, just as
Well,
a
I did used to
concept?
identify with a non-binary label. So I identified as genderqueer, which pretty much just means weird and androgynous. And then I identified as agender, which is basically a convoluted way to say that you are against, being labeled and stereotyped. And so essentially all of these micro labels of non-binary identities just mean either androgynous or nonconformist in general. And so I think they're meaningless and, childish and
Hmm.
unnecessary, but overall they're just abstract, like solipsistic labels for subjective, self-expression.
Yeah, it just seems like it's a lot of extra steps for everyone else and just a lot of
Yeah.
complication for no reason.
Yeah, it
I'm
is. Yeah.
I'm glad that's your answer, so I don't have to like tiptoe. I didn't get the idea I was gonna have to tiptoe around anything, but I was curious,
No,
and
you don't have to tiptoe around
I
anything
like
with.
I like your answer. So you're saying this was still like it was still only like gay straight alliance kind of stuff. It's still kind of new. How these people that you're seeing on Tumblr, like how long have they been exposed to this? Like how far are they in their journeys? Like how long has this been a thing just kind of culturally? Because gosh, if you're not in this, you don't know anything.
Yeah.
You don't even know this is happening.
I mean, it was a very, very, there was, a spectrum of ages, but mostly
Mhm.
on Tumblr, it was like middle school to college age, maybe up to 30 or so, the main demographic, mainly women. And it was a very much a gay platform, and an alternative teen platform. So, there was a lot of my peers, so my age, so people who had been questioning, for a couple years more about the same as me. But where I think it was spreading from was the college students, because the queer theory and the sort of women and gender studies, Judith Butler like type of theories would have been percolating there. And then those older students would have brought that to Tumblr. And there was a lot of educational stuff on Tumblr, like, you know, stuff about history and civil rights, and all of these ideas were brought to teens from people that were a little bit older.
Coming from the universities.
Yes.
I haven't spoken to my audience yet about my recent college experiences. I should probably do that at some point, because I know they're hearing a lot of drama on the news and thinking that people are exaggerating about things, but I was just there, and guess what? They're not exaggerating. I'm basically a white fucking devil.
Mm. Is it true? Is it true?
Well, don't tell anybody. Yeah. And that I was in school from the time I graduated high school back in 1992 to now. I've been in college off and on all that time. And in the last, probably since about 2015, all of a sudden some shit got weird. And it just was, I used to be like, you know, because when you're an older student, it's really fun. You know a lot, and you feel like, oh, I'm going to tell these kids some stuff. It's really, really fun. And, you know, the professors are your age, and you're having great connections with them and having all these exciting conversations. And I was having the time of my life. And then all of a sudden, it was like 2 or 3 things happened, and I was just shut down, like as a human. And I was
By
like,
the peers or the professors?
the whole environment with the students. It was the students.
So the
Bless
younger
you.
students were schooling you.
Yeah. One thing was that I had recommended a Sam Harris episode, and the professor was into it. And then when we came back for the next class, she was asking questions about it. And some dude straight up in the chat, because it was a Zoom, in the chat was like, I don't need to hear from some white guy, blah, blah, blah. And my mouth was just like, what? Like,
Wow.
you are allowed to say that shit out loud? What?
Yeah, that's very
fuck?
that's not, it's not academic, and the professor should be moderating that behavior.
She didn't notice. So then a whole thing started going in the chat, and people were dogpiling on me. And I'm sitting there bawling my face off. The professor still has no fucking idea. I had to log out of class. And then I called another professor and was like, bro, what do I do? Like, this can't be legal. Like, what if I had said, I don't need to hear from some fucking black dude? Like, I would have been lynched. You can't say those things.
Right.
And that was the first thing. And I was like, wow, this kid just bold, feels super comfortable saying that out loud. Like, what?
No, that's the entitlement. Yeah. I wouldn't fare well. I wouldn't fare well if I went to school. Like, I consider like going into academia, like in psychology and evolutionary psychology and all sorts of things. I'm like, I don't know how I can't, like, these younger, like, I'm 26, but I've had some weird life experiences, and like, I can't deal with younger people. Like, oh my God. I don't
Acting
know
like
how
they
to deal with it.
know everything. And oh my God. Yeah. That was fucking crazy town. But I want to get back to you. There was other things that happened in my college experience, but I think I'm gonna have to do like a whole episode about that, because it's fucking strange there. And people, I don't know what to say. I mean, I feel like they're indoctrination stations. I don't know. Oh, I know what I was going to say. So this last semester, my cognitive psychology professor was in the middle of her lecture, and tra la 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 la, as a woman, as a person who identifies as a woman, tra la 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 la. And I'm like, what the fuck are you doing to these young minds? Why did you correct yourself? That did not need correcting. The fuck are you doing, you psychopath? And you're a cognitive psychology professor? What's going
it's
on up there in your little frontal cortex, babe?
the academic, their colleagues are the ones that are taking cues from the entitled student population, and then the colleagues police each other doing it for the sake of the students that they should be, teaching.
It feels real not America-ish. It's a real weird fucking feeling. It's weird to feel like it's very unsettling. And people, it's interesting because these kids, they don't know any better. But I've seen the change, so I'm seeing it. But these kids aren't seeing it. Like, I don't think any light bulb went off when she said that. And probably in anyone else's head, they were just like, she's just being politically correct, and that's what you're supposed to do. And I'm like vomiting. Okay, so I logged out of class instantly. I was like, there's no other way I can fight back. All I can do is leave. So I left. And then when I did her review, I just said there was no reason for the professor to do it like that. And that's all I got to say. Okay, so let's get back to when you transition. And did you do this like with your parents' knowledge? Was there a social transition first?
Yeah, there was a social transition. I mean, I, was already dressing, androgynously and very masculinely my entire life. And my parents were fine with that. They accepted me being, quirky my whole life. So, there wasn't some like radical aesthetic appearance change in any way. I did start wearing a binder when I was 18.
How'd you find out about the binder? I'm assuming online.
It was just kind of, it's very common knowledge, like on Tumblr and, talking with my peers I was friends with mostly gay theater kids who didn't realize that they were gay yet. So they they were leading
like
me on.
all of the theater kids that came before them.
Yes. So unfortunately, I was too naive to realize that they were never going to reciprocate my love for them, and because they were gay, and they were too naive to realize like you shouldn't be leading someone on who has like a lot of trauma, so it was a really toxic situation with them, but we discussed it, as friends, and I was wearing sports bras all previously before that. So
that's
it's
not
like
a big leap.
It wasn't that much of a leap really, and I had very large breasts, so the binder, it was never very like tight. It was honestly like I would sleep in it. Like I never had any physical health issues from it. Like some
Why'd you
people
sleep in it?
Laziness.
Oh, is it a pain in the ass to take off?
No, just how sometimes you just fall asleep wearing whatever. I was very depressed and I slept a lot, so.
And so it didn't cause you any problems?
No, it didn't.
How long did you use it for? I'm sorry.
I used it for 3 years.
Well, that's somewhat encouraging. Not that I encourage one to anybody, but that's good knowledge just to have, that I'm not going to be super horrified by everyone's first. If people have a minute to change their mind and undo it, is what I'm saying. It doesn't immediately break your ribs or anything.
Well, I will say that partly it's because of my age. I mean, I had already fully developed my breasts and body. I was, 17, 18. It's not the same as someone who's still developing wearing it, like a 12-year-old. Like it's a more severe risk for that person.
Right.
And I was already used to wearing the sports bra. So it was so again, like that was a social transition thing, but it wasn't that different. And then I did start using they, them pronouns when I was 18. And so I used they, them pronouns, and I came out as trans when I was 18. And, my friends were not surprised. They had been kind of, talking to me about it for a while. They were fine with it. And then my family didn't really understand it, and they were somewhat concerned, but ultimately they were just ignorant liberals who, were pretty burnt out due to like just overall like toxic family stuff. And
Mhm.
I was always, different, and I was always weird, and I was always androgynous, and I'd been depressed and suicidal for a long time. So coming out as trans, it really wasn't a surprise. And I mean, it was somewhat of a surprise, but I mean, overall, it was just kind of like, yeah, it's just
It wasn't
Laura.
shocking.
Yeah, it was just like Laura being mentally ill and weird as usual. And, if this helps her, then okay.
Right.
So just very, just ignorance mostly.
Yeah. And are your parents, are they my age-ish? Are they like Gen X-ish?
They're Gen X, yeah.
Because that's what's so shocking to me as I'm learning all of this. The first thing I'm thinking is like, who are these parents? And then I realize like, oh my fuck, these are my peers.
Yeah.
And it's very curious to me. I mean, I get it because, until I heard my first detransition story, I was just like, sure, whatever makes you all happy. Let's just all get along and be polite.
Mm-hmm.
So, okay, so your parents weren't, so how long were you transitioned and just living your life?
Um,
And how was that going?
I mean,
Clearly, clearly
I had
it didn't quite work out.
uh, for a while, nothing was really working out quite. Like, I was very miserably depressed and had, the unprocessed complex PTSD from childhood abuse. And, I had that going on the whole time. So,
Right.
I didn't know what was going on. I have PCOS, so I had
What's that?
hormonal dysregulation,
Oh, hormonal thing.
polycystic ovary
Oh,
syndrome.
okay.
So it caused like severe mood disturbances, irregular periods, cystic acne. It's increased androgen sensitivity. So you already have more testosterone, which might correlate to feeling a little bit more masculine in certain ways. So I had a lot going on. And so it pretty much just things got worse every year for about
Mm,
10, 12 years. And during the transition, it was that was really my lowest point, in terms of my mental health and social health and physical health. I became obese at one point,
fuck.
which is associated with PCOS as well, weight gain. So I was transitioned and living as a gay trans man for 4 years. And it was it was a really horrible time. It was very traumatic, and just more traumatic things kept happening, as it does with complex trauma. You have the original trauma, and then to cope with that, you just get into bad situations and use drugs and coping mechanisms that don't help overall. And I was around a lot of toxic men, and you're identifying as trans, and you don't have a large dating pool, and you have trauma. So you don't have a good sense of discernment. So I was on Grindr, and other like really dangerous apps and stuff,
Mm,
like meeting men for sex and drugs. um and I didn't really have any friends. So it was a very bad time. And I detransitioned at 22, around the same time that I was kind of like, okay, like life, I've kind of let myself go in a lot of ways. And I kind of have to make a decision, like, am I going to kill myself or not? Because I keep debating about it. And the suicide ideation is keeping me stuck. And I need to decide to live.
yeah.
So debated about it for about 6 months. Like, I took a semester off college and just laid around kind of meditating, like just in this weird limbo, until I kind of was like, yeah, I want to take some control over my life and take some responsibility. And I got a full psychological evaluation. And that's when I was diagnosed with PTSD. And that's when everything kind of started to make sense. And
Ah,
I started to kind of wake up a bit. And I was reading some feminist stuff on Tumblr. came across some radical feminist gender critical stuff, and came across some women talking about how they transitioned due to trauma, and they were
Mm.
detransitioners. And I was like, yep, that's on brand. Like that's me. And so I detransitioned like psychologically, because I was still dressing the same, still acting the same way. The only thing different was I eventually just gradually stopped using the they them pronouns, stopped, calling myself trans, and just kind of gradually started to become more comfortable with my body and being a woman. And eventually, maybe like, I don't know, 8 months or so, I just, my parents asked about it, and I just said, yeah, I'm not doing that anymore. And they're like, okay. And then I've gradually just become like a really vocal public figure about it. So they're kind of like, all right, you know, um,
Let Laura do her thing.
yeah, Laura,
Um,
they've always had that philosophy. Like, I don't know, Laura's kind of weird and independent. She's stubborn as fuck. Just kind of let her do what she's gonna do. And, so eventually it worked out, but there wasn't a lot of boundaries to protect me from the drugs or the sex or the surgery.
yeah. So when you first went on testosterone, so because a lot of people, there's a lot of controversy over this, like how much therapy people get, or any kind of care beforehand with this gender affirming model. How did all of that go?
There was really no quality therapy given. I've been, since I was 11 years old, I've been on and off seeing different, doctors and psychiatrists and therapists, and I was never really able to connect with any of them. I don't think they really understood what was going on, which was, symptoms of trauma. And so it was just kind of bad luck that I just ended up with these different providers that couldn't help, and these medications that just they kept not helping, making me sick. And so I did seek treatment for the gender dysphoria when I before I transitioned, but unfortunately I wasn't able to find a therapist who knew what was going on and could help me. And the gender therapist that I saw, she ended up just ghosting me one day. I was seeing her for a few months, and one day I had to reschedule an appointment, and, I messaged her and she was like, okay. And then when I tried to contact her again, I just never heard from her again. And I have no idea why. So basically I got no help. And so I was very alone. And so when I made the decision to pursue the testosterone and the surgery, I didn't have a therapist. I was shopping around for a therapist at the time. I only had a psychiatrist, and I only saw her like every, 4 to 6 months or so.
Right.
And she's the one who diagnosed me with the gender dysphoria and wrote me the recommendation letter for mastectomy. So
Wow.
she didn't do a thorough job. Obviously, like she is one of the most negligent individuals involved, because she didn't do proper evaluation over a long period of time. She only saw me in a psychiatrist capacity a couple times a year, and I was suicidal and had a lot of comorbidities and unresolved issues. And she stated that I was competent to be able to consent to the procedure, and that just wasn't true. um
No.
so, and that's pretty much it. That's all the care that I had.
Fuck. There's no guardrails.
Yeah.
There's nothing. There's no check. There's no law saying that you have to have therapy for people who don't know, in psychiatry, when you see a psychiatrist, it's not the same as seeing a therapist, a counselor, or anything like that. You don't talk about it's not talk therapy. It's not anything. You go in there and tell them your symptoms, and they write you a prescription. That's what a psychiatrist does. They're a medical doctor that gives prescriptions, but they are not a therapist. They don't hear your problems. It's not like that.
Right. And they're not even a psychologist
Right,
where they would have like more medical knowledge and therapeutic knowledge.
right,
So I don't know what business she really even had diagnosing me with that.
right. For fuck's sake, what doctor performs a double mastectomy on perfectly healthy breasts?
A cosmetic surgeon that makes his entire practice off of, at this point, almost like the bulk of his practice centered around FTM surgery and girls as young as 16.
How did your double mastectomy get paid for?
The bulk of it was covered by my parents' insurance. And
Oh,
this is a
wow.
really interesting thing. So the Humana, they were like, the breast removal, the removal of the breast organs is medically necessary, but the nipple grafts are cosmetic. You have such dysphoria that you need to remove your breast, but you have to pay out of pocket to have nipple graft put back on your body because that's
Because
aesthetic.
having nippleless tits wouldn't make you dysphoric?
Right.
Like, what the
So it
fuck?
makes
That
no
is
sense at all.
ridiculous. That's just like, by the way, we can add this other charge, so let's go ahead and just charge extra for nipples.
Yeah. And
Wow.
the most of it was about $10,000 overall. Most of it was paid for by insurance. And then I paid some of it and my parents paid some of it. And some of my aunts paid for some of it that I asked, like liberal aunts of mine who had money. And they were like, sure, but yeah, the nipple grafts were paid for out of pocket. You can't really make
It's
this shit up, man. It's just like,
it's so fucking ridiculous. I'm just thinking of like like a retail situation where you're like standing at the counter, be like, I mean, do you want fries with that burger? Like, do you want
yeah,
nipples with your
that's literally how it is, man. That's how they treat it. And that's how the patients view it too. You see tons of trans patients where they're like, yeah, I decided not to get nipples. I just wasn't feeling it. I wasn't feeling the nip nops. And it was an extra cost and just would have made the surgery recovery time longer. So whatever. Not
Yeah.
that they function anyway. So I guess.
It's like then you have Barbie boobs,
You don't
right?
have boobs at all. Yeah.
That's true. I'm thinking of reconstruction without nipples. Derp. Yeah, there's nothing. You have Ken boobs. So then I know that, so this was covered by your parents' insurance. Most of it, you said, like a bulk
Yeah.
of it. Yeah. And then I hear tell that afterwards, if you decide, or not even if you decide, but if you decide to stay transitioned, which people cannot change sex, right? Like, but quote unquote transition. The insurance, so it's paid for, but if you have complications and things like that, then all of a sudden a lot of things aren't covered by insurance.
Right.
Did you have to deal with any of that?
There was a complication. I had to have a revision because excess fat was left on either side, which usually happens with women who are overweight and they have larger breasts. So I did have to have a revision. I'll be honest with you, I was pretty out of it at the time. I don't remember if it was covered by insurance or out of pocket. But it was very surreal going back into that office like almost 2 years later. I mean, that's how like mentally ill I was. Like I'd had this issue and I didn't even bother to go back in and seek treatment for like 2 years.
Gender dysphoria is different than body dysmorphia, but are they interrelated? Like, were you happy with your body at this point? Did you feel like at the time that was a good solution? or were you still having
Well,
gender dysphoria afterwards?
I mean, honestly, I don't really believe in gender dysphoria. I don't think that it's an abstract diagnosis. It doesn't really mean anything. I do think I think it's a subset of body dysmorphia.
Right,
So
right.
I yes. I mean, again, like these symptoms are so meaningless. Like, yeah, I was having symptoms of complex trauma. I was having symptoms of self-hate and depression and all these other things. So yeah, I was still having all of that. And I didn't like my body or self anymore. And it's like I was, not grounded in reality, not in a dissociated way, but in a way of like things were hypo real, like I was depersonalized in a sense. So it's like I would look at my scars and my pretty much like mangled up looking chest, and I just wouldn't really question it. I would just be
Mhm.
like, wow, this is my body. And again, like I became obese. So like I really wasn't feeling very good about my body, being really overweight, and just I had cystic acne, like severe acne. And I mean, I looked terrible, so I didn't feel good about myself in any way, any better, or, after the surgery. And then eventually I detransitioned and just slowly started to even accept being a female and that I had, done this. And then over the past few years, I've gotten like real therapy, trauma informed therapy, and I've had to process all of the stuff. And I still have to deal with, the disfigurement, it's just a surreal looking body, because it doesn't look natural. It doesn't look masculine. It doesn't look, it's just like a Frankensteinish sort of thing. So that's very hard to deal with. But at the time I was so, out of it that it didn't really hit me.
Yeah, it sounds like there was too many things going on. It's just like
There was too
fucking
many
whatever.
things.
Everything's fucking falling apart. I'm a goddamn mess.
Yep. Yep. And I was using a lot of drugs too. I was on like a high dose of antidepressants, as well as I was using pills and some even hard drugs and psychedelics and all of these different things to numb the pain and escape. And it's like I was, I wasn't lucid really to even be able to accept it for a while.
Yeah, man. So, w- Laura, how do we turn this ship around?
Well,
Well, let's talk a bit about
which,
your advocacy work and how that started.
yeah. So, from those couple women on Tumblr in like 2018 or so, 2019, there was a small detrans women's group, like probably like 30 people on Facebook, like a private group. And it was all
That's already a lot of people. Just, it's only 30 people, but it's 30 fucking people. There shouldn't be one, but please continue.
right, right. But I mean, like at the time, it felt very small, and like
Yeah.
we had to be secretive, and it wasn't being talked about really hardly anywhere. Maybe, I don't know when Kira Bell came out, or maybe Sinead Watson, but there was nothing else going on at all. So
Let me ask you, vibe wise, why did you guys feel like you had to keep it on the down low? What?
I mean, we all had a lot of trauma, and we just wanted to be, protect our, just not be infiltrated by, trans rights activists, or, reveal personal information. Like we're showing photos of our bodies. Like we
Right,
just wanted
right.
to make it like a really safe women's space.
Mhm.
And it had a radical feminist tone to it, and almost everyone there was a lesbian as well. So it was just a bunch of traumatized like butch women, and then
Mhm.
me, who was just straight, but I was very masculine. So we met up in Portland. We had a small gathering, like maybe 20 people, and that was very healing for everybody. And then a couple of us started a website called Detrans Voices, and there was another small org called the Pique Reselience Project. So that was started by Helena and like a couple other people. And so there was a little, like, couple things going on with that. And then I kind of stopped being involved with Detrans Voices because I wanted to focus on my art, going to art school and finishing my degree, because I'd been really struggling to even pick a major for like 4 years. It took me 4 years to even pick one. So finally I picked art, and then I did that. And then when I started getting therapy from what would now be called Genspect, this was before Genspect was founded, but it was the same people. So I got therapy from Genspect therapists, and then they recommended to me, like, you know, you should get involved with other detransitioners, like, because you have no friends and you're isolated. I was like, yeah. And then I started doing interviews and writing some essays. And I found I was very good at, you know, speaking and all that sort of thing. And I just kept getting different media requests here and there. And then it started exploding. And then there suddenly all these new detransitioners came on the scene, like Chloe Cole and all these younger people. And then they just were heavily involved. And then I kind of kept to myself for a while because I'm like, you know, an introvert or whatever. But then I kind of started getting involved with them, and then it clicked, and I was like, yeah, I really love doing this. I'm good at it, and I have a lot of energy to help the movement. So now I'm one of the kind of more prominent figures that sort of, because some of the older people that were doing it, like Helena and Sinead and Kira Bell and Grace Lidinsky Smith, those people who had done more attention, they kind of got burnt out and sort of started moving on with their lives. So then the newer people came in, and I kind of bridged that gap. And then I don't have a life, so I got involved with it. And
You do now.
yeah, I do now.
Tell me about these bills that your crew has been running around the country dealing with, because I know what's going on because I hear your guys' testimony, but then I watch the news and they're framing it, you know, as like hate towards trans people. So what are these bills?
Most of the bills have been for against, so trying to either ban minor transition or affirmation, you know, processes, or a lot of the bills have been validating the state's efforts to keep legislation that says, no, you can't do that. Or like, no, we're going to we're testifying, you know, in favor of the state not introducing new legislation. So because it's easier to try and preserve legislation than to create new, you know, because if it passes, then you have to create even more legislation to try to ban it again. So
Right.
those have been pretty much, you know, anything related to that. There's been one in Texas to try and get detransition related healthcare. So basically, if the insurance companies have to pay, if they're paying for trans stuff, they have to pay for detrans stuff. Unfortunately, that one did not go through.
Not only that, but just incidentally for people to know, there are no medical codes for billing. So there's no way to capture data on people that are detransitioning. So when people are saying numbers and like, oh, they're so low, they don't know the fucking numbers because they
Yeah.
can't collect data because they don't have medical codes for the procedures or even for what a detransitioner is. Just FYI side note. Please continue.
Yeah. And there's a lot of people like me where you go to a clinic like Planned Parenthood or, you know, a similar clinic, like a LGBT clinic, and they're not keeping tabs on you. They're not, processing codes and things. They're just giving you free hormones and or discounted hormones, and you don't know, we have no idea how many people are taking hormones and or when they start or when they stop, and there's no consistency of dosing. And the surgeries as well. You just go to a private clinic, or you get your private insurance to pay for it. They're not keeping tabs on patients, and the only studies that there have been, they've been low quality studies. They're a small population sample, and they haven't.
Sometimes the population sample is one person.
Yeah.
Yeah.
And there's also a
not
huge loss to follow-up in the study, which basically means that, you do a study and you're supposed to keep track of the participants over time, but then a huge population drops out. So they try to say, oh yeah, they've had these positive outcomes on a very small number of people. And then what about all those other people who didn't report back or who have died, or, you don't know the circumstance. So they're
getting
falsifying the
the
information.
runaround too, right? They're getting the runaround, like they're trying to get care and can't get it. So there's
right. And I mean, a lot of detransitioners, they don't even seek care because, they've been so harmed. And when they go back to their clinics, I mean, detransitioners have documented this. Like, you go back to your same doctor, surgeon, therapist, or whoever, and they're just like, oh, well, we can no longer treat you. You aren't, part of the trans population. So this is only care for them. And then they have nowhere else to go. And most doctors have no idea, because those doctors or pediatricians or whoever have always been referring people with dysphoria to the gender clinics. And then the gender clinics won't treat you. So then you have nothing.
Well, I know that double mastectomies have been around for a long time, but and I know you didn't have bottom surgery, but that isn't like, they're just kind of winging it, right? I mean, because it's not really.
Yeah.
They're
Yeah. I
like,
mean,
I think this will make a penis. Maybe we'll hope for the best.
and well, the genital surgeries are that's a whole other, level of insanity. But for the mastectomy, like, I didn't even realize at the time that the procedure I was getting was different than what you would do for a typical mastectomy for a cancer patient. Like, for a cancer patient, when they are removing the breast, they do it as a last resort, and they can preserve tissue so that reconstruction is actually possible. They preserve like nerves if they can, and the nipples, and as much of the breast as they can, so that they can, insert the silicone or other material to actually reconstruct. But with this surgery, they don't preserve anything. They don't preserve any tissue. So like, if I tried to, have reconstruction, I couldn't, because there's no tissue to work with. There's no way to insert the silicone. There's no nerves, and there's nipple grafts that need to be removed. There's just nothing, so it's a misnomer when people say you can just go get reconstruction or just go get a boob job, because it's actually a lot more complicated. You have to have other procedures to even get to the point where you could possibly reconstruct.
Why do they not do the same surgery?
Because they're under the impression that all of this, female tissue is harmful and it's parasitic, because, you're supposed to be a male. So they're not going to preserve any tissue or nerve function. They're just gonna, just eat the teats, as they say, and toss it in the trash, because why would this person ever, want to have, those female organs?
Wow, fucking crazy, man. Do you know anything? I haven't gotten into this, and we don't have to get into it either, but I'm just curious what you know about why this is all happening, where it's coming from, who's making all these insane laws and rules and shoving it in every corporation, and it's worldwide. And it's in the schools, and people's like, it's super controlling, and like it's like the fucking blob.
Yeah, I mean, it's multifaceted. I mean, so
Yeah.
essentially, originally there was the gay liberation movement, and that was about same-sex equality and fighting for, marriage equality. And basically, it was just about gays and lesbians having equal rights and acceptance and visibility in society. And then in that same culture, there were subcultures of, mostly, effeminate men who were cross-dressers and transvestites and, prostitutes and, fetish stuff going on. And that was just kind of accepted in the gay community because, a lot of them were gay. And if you were a decent person, it didn't really matter, like you just being androgynous. But then there were a couple people who took it to the extent of being a transsexual, which was someone who was so effeminate as a male or so butch as a woman that they thought it would be easier to live their life in society as the opposite sex. And those people were, and most of the time, they were screened very heavily. It took years to transition, and there were very few of those people. And over time, gay acceptance became the norm. And, in the United States, gay marriage was legalized. But what had happened was there was all this funding and all this campaigning around these issues for these organizations. Now they had to champion another cause. So they started funneling most of their money into the trans population. And there was a lot of money to be made there because it's a very marginalized group. It's a small group of people, but definitely a ostracized group. So there's plenty of sympathy points for them. And then, the pharmaceutical industry is getting bigger and bigger and bigger. And sort of the model of care in the West is becoming more consumerist. And so medications are more prevalent. There's a lot of money in pharma. And so the coalescence of these two things created a great demand for, testosterone and estrogen to then be marketed, because they didn't really know what to do with testosterone and estrogen, and they had synthesized it for a while, and now they were starting to market it and sell it. And so, of course, they're selling it to these LGBT organizations. And at the same time, in academia, the postmodernist theorists, were kind of deconstructing everything, and every sort of, language was trying to become more politically correct. And so a lot of it came about during the Obama administration, because that just, sparked so much conversation about race and sex and LGBT stuff. So after that, gay marriage was legalized. There was the Black Lives Matter movement came in, critical race theory was coming in. So academia, pharma, the organizations, all of these things combined to start kind of promoting these ideas about, trans youth and gay youth. And it got filtered in through LGB acceptance. The T was then, raised up, and all this money started being made from these corporations that then started advertising pride, and it became a corporate affair. And to get public acceptance from a, changing liberal culture that was becoming more woke in race and all these other ways, tensions were rising politically. They had to get on board with the agenda of the LGBT stuff, where queer theory was, funneled in. And now it's just been increasing and increasing since then.
Big, big, big money maker. This is reminding me of the same thing with the homelessness issues and the advocacy for that. It's big money makers. They can never fix this problem because there's so many organizations that exist now just because of that. So many people would be out of work. There's no incentive to fix that.
Right.
And now, so God, the pharmaceutical companies have no fucking shame. They're just like, let's go after the kids. We've got all the adults on SSRIs. Let's put all the kids on hormones.
And
much more?
SSRIs.
And yeah, let's put them on both.
And ADHD medication.
Fuck. They have no shame. I wrote a paper about the pharmaceutical lobbyists for my speech class. They're the number one. They've got so much fucking money. It's ridiculous. Like they could buy the planet. I mean, they've got so much fucking money. Crazy. And all of this direct to consumer marketing, like it's only a matter of time before we start seeing hormone blocker commercials. Could you imagine?
I mean, we already see them online. Like you already see
for little kids
ads and TikTok and all these things. You see ads for, like, I've been recommended through my algorithm, like, getting, especially for Pride, like, accessing hormones and accessing, surgery letters. I mean, you see them advertised, like, we'll write you for like, $200 or whatever. We'll write you a letter to get your surgery.
And I'm laughing at because my algorithm just showed me it wants to sell me a taser gun. And those algorithms are fucking accurate as hell. I'm like, it knows.
You must need one.
It knows that my neighborhood sucks. So random. Let's talk about this. I talked about it a little bit with Gabrielle, but I'm just curious to hear your thoughts on this. I know you don't live in California, but this law that they're trying to pass in California, where if you don't affirm your child's gender, the state's going to take the kid from you. What do you think about all that?
I mean, I think that's one of the most evil things imaginable. I think that, the state taking away a child, that's an extremely radical intervention. And, in other cases where there's interventions, there's different forms of intervention for child abuse or neglect. And they always ideally, they try to let the child have as much contact with their family as possible, maybe supervised visitation, different things. For this, it's extreme. I mean, they're just removing them completely. I know parents that have had their child 100% removed. There's no visitation. They're not allowed to contact them and they don't get to see them. I mean, that's, unheard of, except in extreme cases of abuse or neglect.
And this is all just for refusing to play the pronoun game.
Yeah.
Right. It could be something as small as that.
Right. And that's why it's even more evil. I mean, it's evil just for the sake, for taking away for no reason. But then for the reason that they give really is because you're not going to allow your child to be, indoctrinated into the cult. You're not allowing your child to be, modified, like surgically modified.
It's so insane. We've talked about this before, and I've mentioned it several times before, that when you start talking about this stuff, you sound absolutely nutterballs, but this shit is fucking real. You lived through it. It's happening. We're passing laws. They're not putting any of it on TV, so nobody knows about it. They're very serious. What they're doing by putting all of this transgender stuff in the school, they're implanting these ideas that you aren't attached to your body to very small children, brainwashing them, and then stealing them from their families and sterilizing them on top of it. What the fuck is this agenda? I don't understand I mean, do they not want future customers? I don't understand the sterilization thing. It's fucking bonkers. I mean, a lot of people don't understand that. They because they're not being told that if you're getting puberty blockers very young, chances are, right, you're going to be sterile. What happens with all that?
I mean, I think most of it on the parents' behalf is ignorance. Right. And it's fear. They're fearful that it's either a sterilized child or a child who kills themselves. Right. So they choose a sterilized child. And even so, maybe they do know that there's some risk. It's severely underplayed. And again, it's put against, suicide. So from the parents' perspective, they think they're making the best choice in a very hard situation. And they trust the doctors because the doctors are so calm and paternalistic about it, just saying, yep, this is the normal treatment. They're very glib about it. And that puts the parents at a false sense of ease about it.
Oh,
From
like
the
when they were
doctors,
joking to Jennings that might as well be a porn star because we take so many videos down here. That kind of
yeah, I mean,
glibness.
Marcy Bowers is an extreme like example of this, like a case study of this. But the everyday doctors, I'm trying to think their motivations. I mean, someone like Marcy Bowers is a prominent figure in WPATH, and but the lower level clinicians and doctors, I'd like to think that a lot of them are just, kind of overworked. They don't have much time to like research this and really think critically about it. And the money is coming in and they just have to listen to their supervisors. And from what we've heard from whistleblowers in the United States and Britain, that does seem to be the case, where they're just kind of following orders and they're just like, okay. And, a lot of it is coming from WPATH, because WPATH used to be the Harry Benjamin Society, and the Harry Benjamin Society was associated with Johns Hopkins University, and they researched transsexuals. And so they were researching a much different group of people, different ages, mostly men, not young girls or minors. And the research of WPATH has evolved over time to get more and more.
Good Lord, have mercy on my soul. What about all these fucking crazy ass porn books that they're putting in the schools? Do you know anything about that?
So as an artist, I know the types of people that are making these books. They're my age or a little bit older. They're a lot of them have some mental health issues, some sexual issues, some developmental trouble, and they are making these comics and graphics and writing in this very adult, dark humor type of way with adult themes. And they're making these books for children because they are living out a fantasy of what they could have been growing up. And so on the face of it, I don't necessarily have a problem with people just drawing and making comics about dark things about their life, and mental health problems. The issue is that they are marketed to children as normal, as healthy, and as just part of growing up, when it's not even so much that a lot of these books are describing graphic sex. It's also that they're normalizing body dysmorphia. They're normalizing cutting off your breasts. They're normalizing eating disorders, and they're propagating detachment from your body, as well as then introducing erotic themes. And obviously, kids have a lot more risk in being exposed to sex and porn these days, but that doesn't mean that there should necessarily be guidebooks in elementary or middle schools for how to have gay sex or any sex. So from my perspective, I know why people might, I'm trying to give them some credit. The people making these books aren't necessarily all, pedophiles and groomers. Some of them, yeah. But I think a lot of them are just, doing some really dark, expressive work. And then it's the school's responsibility to realize that's an adult book. Maybe that's a college level book, not appropriate for children.
I don't understand how this is getting through. Who thinks this is a fucking good idea in the school?
That I don't
Happening
know.
everywhere. It's not like it's just some one weird school where this book got in. It's
yeah, it's I don't know exactly who makes the teachers have a lot of control over their individual classrooms. To my understanding, these books aren't being pushed necessarily as part of the curriculum.
No, they're like in the library, right?
Yeah, it's up to the individual discretion of the librarian or the teacher to include it in their library. To my knowledge, I mean, obviously it's not happening in every single school and every single district, but there's enough of these sort of liberals who are either extremely ideologically captured or liberals who just are mentally unwell and don't have children's best interests. I'm not saying they're necessarily, again, pedophiles or groomers. You don't have to be a pedophile to have a very poor sense of boundaries and have a complex around projecting subconscious issues onto children. So I feel like it's more complicated than just groomers and sex. Like I think it's psychological, and I think a lot of it is being done for social justice reasons, because if you are a underpaid, frustrated, mentally unwell teacher, and you are extremely passionate about having control over your life in a certain way, and that control is authoritarian, radical leftist politics, you are going to want to push the boundaries as much as you can to stick it to, the man, the administration, anyone who's trying to control you to gain power over your life. That's why you pick the most, divergent book that you can find and say, yep, my kids are reading this. I'm progressive. I'm on the right side. And I'm having some sort of almost revenge fantasy.
Yeah.
Some of them. This is obviously just my
Well,
speculations.
that's making me think of when the whole drag thing went down. And I don't know if there was I don't know what the fuck it was, but Charlize Theron made like a statement. She had some friends and she was like on her phone and she was trying to support her drag friends. And she did that whole, I'll fuck anyone up who messes with you. And like, she has no clue, obviously, what people's issue is with the drag stuff. They're not against drag. They're against drag in front of children, highly sexualized or whatever. And she literally said while she was screaming, it makes you a better person. And I'm like, what the fuck kind of crack does she smoke? Watching drag makes you a better person? What?
Yeah, that's
I like drag. I don't
fascinating.
have a fucking problem with drag at all, but it doesn't make me a better person to watch it. Like, what kind of weird ass thing to say is that?
Yeah, like, does watching Jerry Springer make you a better person? Like, just because you're consuming like hedonistic, funny, whatever material, like at most it's neutral. It has a propensity to be negative, but making you a better person, no.
Just such a weird thing to say and not correct.
Yeah, that's pretty
like, I'm nobody, and I deleted a bunch of shit that I said on Twitter this morning. I sure as fuck wouldn't want it makes you a better person, just like living in the ether for the rest of my life, sounding like a complete, and I like her. So it's just so, I'm like, what in the hell is going on here?
Well, Holly weird,
Well,
they can do whatever they want.
I just don't see how we turn the ship around when it's so ingrained in the number one, like, brainwashy thing we have, which is Hollywood. I mean, all of these actors, like, they themselves are like, I'm a they, them. So here we go. This is what we're going to do. And this is how we're going to talk. And this is how it's going to go. And everyone else in Hollywood has to say, okay. And if like friends that I haven't talked to in a long time, because I told you, I don't fucking talk to anybody anymore, but I've been here a long time. And I post these on Facebook. People I know are going to see this and they're going to be like, where's the Melissa that I used to know? What is going on here?
You've awakened.
Yeah. Peaking. Are we going to peak these people?
What do you guys think?
Are you peaked
yet?
I explained what peaking was a couple episodes ago, so we'll see what happens. I'm trying to take people on a journey because, again, there's so much information and I'm just like, there's no way to catch people up.
Yeah.
Because it's too multifaceted. Now, have you worked with Gabriella? Do you have any lawsuits or anything like that?
I met Gabs briefly in Austin. I am working on formulating a lawsuit. I'm in the very early stages, so nothing has been filed yet. It's very slow moving. So I would I plan to pursue legal action against the hormone clinic and the surgeon, but nothing has happened yet.
I didn't ask you if you had health complications from taking testosterone.
At the time, the damage was primarily done when I was taking it at the time in terms of my psychological destabilization. I've had permanent repercussions from taking it because I became so erratic. And obviously, when I was on the testosterone, that's when I made the decision to have the surgery. And when I went off of it for the surgery, the surgeon requested that I go off of it. I had a mental breakdown that resulted in some toxic behaviors, and I lost my friend group. So it had permanent repercussions socially, reputationally, and just overall, you know, I was unstable and I made the decision to have the surgery. But luckily, since going off of it, I haven't had any lasting repercussions that are deteriorating my health. Obviously, my voice is permanently lowered and I grow facial hair that I have to shave. And
That was
but
going to
luck-
happen anyway, just so you know. I shaved this morning. When you get older, you just have to.
yeah, especially with PCOS, you know, that's another symptom is being hairier. So you know, if I really needed to, I could just be like, yeah, I have PCOS, you know, but so luckily I escaped, oddly enough, because I had the surgery and he wanted me to go off, and then I was doing so terribly that I didn't go back on. I put it on pause, but then I detransitioned. So I luckily never was exposed. I was on it for 7 months at a high dose. So I'm actually very fortunate that I didn't have any other complications.
Yeah. I want to switch gears just a little bit because I do want to, well, you can tell me what you want to talk about first. I want to ask you like what you think people listening, like what the fuck can they do or should they be doing or whatever? I mean, I guess listening to us would be the
Yes.
first thing.
Like and subscribe.
Yeah, I want you to plug all of your things. And yeah, I want you.
I'll say in terms of people helping, I mean, you know, we all have different roles that we're playing in different jobs, and we all have different skills and networks. And so I think everyone's task is different apart from listening. You know, the main thing you can do is just listen, gather information, and just try to increase your knowledge and awareness so that in the capacities that you have, you know, maybe as a parent, you obviously are in a very particular position to safeguard your children against, you know, the internet and indoctrination. And you start to learn language is a huge part of it. You start to learn the language of indoctrination and how you're twisting reality, and also how people compel you to use language. Like, you know, instead of saying, you know, like a trans woman or a trans man or a trans child, you just say a person with gender dysphoria, or you can even just say a child or just a man or a woman. You know, like you start to, you know, deprogram from all the linguistic, psychological mechanisms that have been conditioned. Everyone should be doing that. And then obviously parents have a duty to try and their best to protect their children against, you know, these lies and inform them of what the truth really is and guide them into, you know, safer forms of expression. And then, you know, obviously if you're in education, that's an extremely useful opportunity to sort of teach, you know, students critical thinking skills, you know, use propaganda and show them examples of modern day propaganda. And you can be subtle about it in teaching, you know, these programming techniques so that they can start learning it for themselves. Obviously, anyone who has any sort of platform where they might be in a position of job security, you would be the best people to help. Someone like me as a freelancer, I don't have a boss that I need to worry about speaking the truth. And so someone in that type of position has the best chance to, write about these topics or publish a piece or share something on social media without fearing the repercussions. But still, everyone, if you can share as much as you can with your network and do it in a way that, you can still be professional and talk about critical thinking. You don't have to go as intense as, some of us do. But it's just slowly waking people up. But that starts with yourself and waking up to maybe other ways that you've been programmed. Think about history, think about different movements that we've had in history, recent history, and how maybe the civil rights movement is actually different than what's going on today. Compelled speech, is different than, just free expression. And so just turn to, common wisdoms that we've had for, many generations and apply them today. I think everyone can help out doing that. And slowly the public will wake up and parents will wake up and more people will speak out. And the more of us there are, we can then being able to, put our money where our mouth is and fund or defund certain, corporations or, trust different doctors. There's many different people with many skills. We don't need to give all our money to these people so that they have this power and we feel helpless. It's just going to take some time.
Yeah. It's got to be interesting for you because you've been in this for such a long time, and then there's people like me that just kind of bust out and they're like, what? Like, you've been in this for a while. What do you feel about the momentum that's all of a sudden happening?
I mean, it was kind of a surprise at first to see so much happening, especially because I have a lot of personal stuff going on with my healing, and I'm very introspective and tend to kind of do my own thing. But I'm really happy with what's going on. More people are waking up and just being like, what the fuck, and the more people who are willing to speak, to me and other detransitioners and other journalists and people who have been studying this and have already deprogrammed, the better. I feel optimistic about the legal changes, especially. I feel optimistic about media changes, and the political changes are complicated because there's always like the extreme pushback that progress versus tradition will always kind of push each other back and forth. And I'm not totally on board with obviously either progress, or tradition, conservative or liberal. It's, it has to be that way, which is good, but, it can get intense.
Yeah.
I ultimately feel optimistic though about it. And, I feel optimistic. The only thing is that I do feel like there's already being more and more people coming out, my age and younger. And, a lot of people are being harmed like early on in life. And, I will say, it's not the first time that that's happened. I mean, we've had many wars, many, impoverishment, all these sorts of issues where young people have had really traumas early in life. So I do feel hope that people can be resilient, but at the same time, what are you really supposed to say to a young person who was sterilized as a kid? And what are you supposed to say to someone who can no longer give birth or no longer has functioning genitalia? There's only so much that, there's grief that we will have to live with for the rest of our lives. So it's still not okay that any of that's happening. And I'll have to say the mental health system is trash, and there needs to be an overhaul of the therapeutic profession and the educational profession in order to be able to deal with the younger generation's mental health issues in general, but especially these. So if I have anything to say about it, like I clearly have a lot to say about it, but if I have more to say about it, I will, just keep pushing the psychoeducational message of trauma informed, family and community and, common sense.
Yeah, that's all very, very good things for people to chew on. The very first thing that you said, you were talking about the language, and that's so important. It's also, it's the easiest step, but it's the hardest step, because right now everybody's speech is being compelled. So I guess to drive that message home, when and where you can, don't use the made up words. If you're amongst, say, friends, if it's a woman, say it's a woman, and it's a man, it's say a man, those things, right? Don't they, them, what are there, fucking 15 people here? Like, we're not doing DID. That shit doesn't exist. There's no multiple personalities. There's no they, thems. We're not changing the rules. We're just not. We're not changing the language. And and I've mentioned this many times before, but it's number one cult tactic. Change the meanings of words, and then you can kind of get away with anything. Because then nothing means anything.
Because if they control how you speak, they're controlling how you think.
Yes.
So
highly recommend anyone who hasn't read it or seen it in a while to revisit 1984 and realize, like, oh shit, I just got plunked in the middle of the novel. I didn't even see the beginning. I'm just in the middle of the novel all of a sudden. Because that's what happened to me. Yeah. So what everybody here, I mean, some people know that this is Funk God, but we haven't really talked about the funk. And Laura is a funk god, and I got funky just for her.
Yes.
And I want to hear about all your funky stuff, because you're a great artist and you have a lot of fun, and I want people to look at your stuff.
Yes. So, apart from the really intense, intellectual analysis, I actually am an artist and a graphic designer. So this is one of my shirts. Believe detransitioners first do no harm.
I love it.
So I have a whole collection of detrans awareness, sort of activist stuff. I also have a feminist collection, a kind of women's empowerment type, stuff. And
you had those cute little suffragette shorts.
Yes. I have a lot of suffragette flags, trying to go back to the basics of real feminism, women working together to advocate for, acceptance versus, sort of toxic feminine ideas. Apart from that, I have 300 other really funky, goods, apparel and home goods. I have so much different stuff. I have baby clothes now. I have it's all based on kind of living that funky lifestyle, so kind of I came up with this yesterday. It's 70s funkadelic culture meets Taoism.
Oh, I love it.
That's what Funk God is, essentially. So where you can find me, I make a lot of content. You can find me on Twitter. That's my main platform. I write a lot of tweet threads.
It has a lot of dark humor that I really enjoy. I feel guilty laughing, but I know that you understand. That's why I tell you, that shit made me laugh. I know you're not trying to be funny, but I do the same thing. When I'm tragic, people laugh and I'm like, motherfucker, I don't feel good right now. And it's all funny.
Yeah. Well, no, I do a lot of coping humor. But yeah, I do tell a lot of jokes. I do try to balance the good funks and the bad funks. So I really try to keep it balanced. Funk God Artist on Twitter. I also have a YouTube channel where I do my own interviews. I do a Funky Psyche series where I interview independent thinkers and talk about what it means to be funky. as well as, I do testimonies and speeches and things. They're all on there. I also have a Substack also called Funky Psyche. So I write essays and kind of post updates on there. And of course, I have my Etsy store, and that's the best place where you can support me. I love to see people wearing my funky stuff, as well as, things that have a good message too. So you can find that under Funk God on Etsy. And if you're
I'll put everything in the show notes too, so everyone has
yes,
links.
yes, all the links. And then if you don't feel like being funky for whatever weird reason, you can just give me a regular donation. I do have a fundraiser for detrans awareness, and I am raising money currently because I'm doing kind of a summer US tour in a way, in Florida and New Mexico, possibly Arizona, and who knows what else, to try and raise awareness and do some lobbying and trying to, do some big events, organize some things this summer. So that link can be posted from my donor box as well.
We'll definitely want to be, we'll want to keep abreast of your summer and all of your adventures and see what.
Oh, you'll hear about it on Twitter.
Yeah.
God, if I ever don't post on Twitter, my addiction has either been cured or, or something's happened.
Yeah, mine's getting pretty bad. I couldn't give a shit about Twitter like a year ago, and now I'm just like, and I love Twitter Spaces. They're so cool and fun. There's just amazing conversations happening. Just really, you can just hop in and it's like, oh, there's these great people that I'm like fans of, and they're like in the middle of a conversation, and I get to hear it in real time. It's so cool. You think there's anything else?
I'll plug one more thing. If people want to learn more about detransition, I think a really good way to start would be, or about these topics, check out on YouTube Genspect, or go to genspect.org. I've worked with them a lot. They are a counter organization to the propaganda organization. So they do really evidence-based, healthy, holistic-based research and help in campaigning for detransitioners and parents and all sorts of gender-related stuff. And there was just an amazing conference in Ireland that I attended and spoke at, a 3-day conference with just amazing speakers from feminists to parents to academics to detransitioners. That's where the densest material is if you're willing to take that leap. And there's a detransitioner panel with me and like 6 other people. It was moderated by Benjamin Boyce. So it's got a lot of really, really useful different perspectives for both males and females for detransition. Nice.
That's great. That's really great. I actually haven't, I've been meaning to look at that panel. I'm gonna have to check that out tomorrow. Well, Laura, I have to say, I am really, really, and I really mean this, I'm really honored that you would talk to me and do my show, because I know you don't know me from Adam, and I know you are all being pulled in a billion different directions, and a lot is being asked of very, very few people, and it's a big, heavy load. You clearly are doing it with a lot of grace. You're so much fun. I'm really, really glad I got to meet you. I love your personality, but it just means a lot. I told my husband, and I was like, oh my God, I'm so honored to get a job. I'm so happy. But it really means a lot. So thank you so much. And I really, I really hope that the message got through, and I'm really grateful that you came to tell your story.
Of course. And I could tell you had a lot of energy. And, I really respect that, and just appreciate people that, there's a lot of people who do a lot of talking and complaining, which is fine, but just do something else too, so you're actually like making content, really trying to inform people. So, that's a very positive, example. And I know you're kind of studying, psychology and things. So I think it's worthwhile to, because it inspires people, inspires both parties when you have these conversations. with two people that both have a lot of energy, because then they go out and actually do stuff. So,
Yeah.
you know.
Yeah, I'm really inspired by the work that you guys do, and also still because you're all still going through things and getting hurled lots of abuse online and things like that. It's I mean, I know everything that you've been doing, but people listening who are just meeting you, like they have no idea, which is why I'm doing these episodes, because just so much of this information just isn't getting out there, and it's just so important for it to get out there. But anyway, yeah, I really appreciate you.
Thank you.
Thank you so much.
It is man.